Auzu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. So guys, just a quick discussion of preeclampsia today. We know that the definition of preeclampsia is that either it's new onset hypertension of more than 140/90 from beyond 20 weeks, and this is not enough. This is enough for gestational hypertension, but for preeclampsia, along with this hypertension, you need to have one of these three things. So what is those three things? If one of three is fulfilled, then that is preeclampsia. So number one is proteinuria. So normally when proteinuria is +1 on dipstick, then that is an indication to further quantify. If it's trace, you're not supposed to quantify it. And how do you quantify it? Do you do 24-hour urinary protein? No, we don't do 24-hour urinary protein according to these guidelines. Okay, you are supposed to do the albumin creatinine or protein creatinine ratio, AC ratio 8 or above, and PC ratio of 30 milligram per millimole or more, and that is enough for proteinuria preeclampsia. But dipstick needs to be +2. Okay, so either one of these, either +2 on dipstick, which is equivalent to 1 gram per liter, or 30 of PC or 8 of AC, then that proteinuria is significant for preeclampsia. And then the second point is any sort of organ dysfunction, which includes 4 organ systems. The renal dysfunction, for renal dysfunction, the CRET would be high, 90 micromole per liter or more, or 1.02 milligram per 100 ml or more. Or there will be liver involvement, which will include elevated transaminases, ALT of 40 or above. And then neurological complications can include eclampsia, altered mental status, blindness, stroke, clonus, severe headache, or persistent visual scotomas. And then hematological complications can include thrombocytopenia, platelet count before 150/100,000. This is a very important point. I need your attention here. Okay, remember, isolated thrombocytopenia, platelet count is less than 150. That is not significant. That is not dangerous at all. Okay, if you do a medical consult for 150/100,000 platelets, the medicine department would laugh at you. But mind that if this level is with hypertension, then you are going to think about preeclampsia. Okay, so you must check blood pressure with a falling platelet count trend. Platelet count of 150/100,000 or less with hypertension is a red flag, and you are going to rule out preeclampsia. Okay, uteroplacental insufficiency, such as fetal growth restriction, abnormal umbilical artery Doppler waveform analysis, or stillbirth. So any one of these three things and you have preeclampsia, guys. Okay, this was a very simple discussion.